We are back with Dr. Cynthia Snyder, Cone Health Infection Prevention Medical Director. We're talking about flu shots and how to stay healthy this fall. So lots of people are worried about the potential side effects of the flu shot. Can we talk about some of the steps that we can take to manage some of those side effects?
So usually people can start having the side effects of the injection, like having a sore upper arm. And you can take Tylenol or ibuprofen in the evening, and that usually should suffice. Or I'm a fan of actually getting it in your dominant arm, because the more you're moving your arm around, I think that helps dissipate some of the discomfort that's associated with the vaccine.
All right, and we've been hearing about the high dose flu vaccine. Who is that recommended for, and are the side effects similar?
So I would say the high dose vaccine is formulated for folks who are 65 and older. And the reason being, it does have a higher load, I guess I would say, of the viral antigens in order to get the proper immune response. We know as we get older, our immune response to vaccines aren't as robust as they used to be when we are younger. So this high dose vaccine works better than the standard dose. You can have the symptoms of the vaccine side effects last probably a few days longer. So I would say that it's not unusual for people to notice that discomfort for more than 2 days.
And that discomfort in their arm is what we're talking about. Okay. Now, there are some people who will not get the flu shot just because they don't like a needle, which is why there is a nasal spray vaccine. So who can get that, and what are the additional side effects of the nasal spray?
So with the nasal spray, this actually has been around in the past, I believe since 2003, but it was pulled off the market because it wasn't formulated to have enough of a vaccine response. It is the only FluMist is the only needleless flu vaccine available, and it's marketed for people who are older than 2 to 49 years old. And that is one option if somebody has a fear of needles or convenience, unable to get to the pharmacy to get that vaccine. However, it's not as effective as the injectable flu vaccine. And I would check with pharmacies, because I'm not sure if the timing is going to work where it's going to be widely available for this flu season.
Okay, that is good to know. Now, we know that you don't have to go to the doctor to get your flu shot. You can go to a pharmacy. Cone Health has those pharmacy locations. Do you need an appointment for that?
So I think it really depends on your, I think the pharmacy's website would show some appointment times, or you can call ahead. But I think that's what's great. Over the last few years, you get all your vaccines through the pharmacy at your convenience, right? You could get your flu vaccine, you could get your COVID vaccine at the same time. You can even also, those who didn't receive the RSV vaccine last year, for folks who are 70 and older, they can also get an appointment and get all those vaccines for the flu to prevent any respiratory viruses this season.
Okay. And once you get the flu once, you don't ever want to really get the flu again because it's awful. So in addition to getting the flu shot, what other steps can we take to protect ourselves and our family?
That's the thing. We already know this. We've been through, since the pandemic, a lot of us have become well-versed at hand hygiene, wearing masks, especially if you're about to go travel, wearing a mask on the plane. Or if people are symptomatic in your household, hand hygiene, wearing a mask so that you yourself don't also become infected with it.
All right, we have about 1 minute. What kind of over-the-counter medication should we have at home in case we're exposed to the flu or get the flu?
I am a fan of just old school. I would just take Tylenol and ibuprofen, stay hydrated. If you have some nasal congestion or cough, you can think of like Robitussin or guaifenesin kind of combinations. So it's really, just going to your local pharmacy and seeing what symptoms works best.
Okay, and any final quick thoughts about the flu shot itself?
you know, nobody likes being sick and taking time off, and you want to be your best during the winter because there's so many activities to attend. So I'm a big fan of getting all the vaccines that I'm eligible for.
Okay, thank you so much for your time and your expertise. We appreciate it. Right now, we're going to take a quick break, check out the forecast.